Hello, my name is Don Tatalovich. I'm the owner of Cornerstone Dental Center. I'd like to talk a little bit about our philosophy on preventative care and why early treatment matters in relationship specifically to fillings and cavities. So with dental treatment, we're pretty conservative with treatment, and so we want to evaluate things. If possible, our goal would be to prevent things, frequent cleanings and preventative tools, home tools, allowing patients to go through a really efficient preventative routine at home, so that when we see you, we can reassess things, we can fine tune things, and just continue to prevent issues from happening. Why might early treatment of cavities be important? So if our preventative efforts, for whatever reasons, have failed in an area where we've seen a tooth develop a cavity, assessing that and when it's necessary, addressing that sooner than later will prevent that decay or cavity from moving further into the tooth, closer to the nerve, and causing more loss of tooth structure. So over time, if we have a larger filling on a tooth, that's something that as you're chewing, that filling is more susceptible to wear and or failing, as well as a new cavity developing. And so we want to prevent that from getting any larger than it needs to be. What is a dental filling, and when might it be necessary? So for a tooth that we've seen the bacteria in your mouth create a hole or cavity in the tooth, once that moves through your enamel, that's the outer layer of your tooth, that will start to move into the softer dentin layer behind that enamel or beneath that enamel. And so with that, once we see that happening, we need to take the cavity out, clean the cavity out, and place a filling there to replace the lost tooth structure. So what is a filling then? So a filling is a modern filling is a bonded composite material, and so that material will actually bond to the tooth, and we'll be able to sculpt that into whatever shape we need to in order to replace the lost structure that has been taken out due to the bacteria or decay in the tooth. How might I know that I have a cavity? What symptoms might present, and what would your next steps be with that? So for a cavity, that's usually going to present as possibly cold or temperature sensitivity, some sugar or acidity. If you're taking acidic foods or beverages, sensitivity to those. Those symptoms are not always an indication of a cavity, but sometimes you'll see those initially when you start to have a cavity. What type of dental filling does Cornerstone Dental Center provide? So at our office, we provide composite dental fillings, and so those are bonded to the tooth. After the cavity is removed, the decay or cavity is removed from the tooth is cleaned thoroughly, and then a bonding procedure is performed in order to allow that filling to adhere to the tooth. And so these bonded fillings are tooth colored, and they're very aesthetic and very durable. For modern dental fillings, how do those differ from what one might remember having placed in the past, or what was historically placed? So in the past, most often patients would have received silver amalgam fillings, and so those were an amalgamation or a collection of silver, that mercury material, as well as some other metals, and so those were condensed into the tooth after the tooth was cleaned and the cavity was removed. So as far as how those differ from our current technology, now with the bonded fillings, those will allow us to be more conservative with the removal of tooth structure, as well as sealing the tooth with that bonding process. That's something that the silver fillings didn't, that technology didn't allow a seal to the tooth. So if I need a filling, what would a typical filling procedure look like for me? After I come in for it could be a cleaning appointment where I have an exam, or if I'm here for a more comprehensive exam, we would do our diagnosis. We'll evaluate teeth and identify a cavity. Once we know that that's there, we'll schedule another appointment and go through the process of removing the cavity and placing the filling. During that filling appointment, we will again remove the cavity. We'll make sure the tooth is clean, and then we will go through the steps to bond that filling in place. And then making sure that everything is restored properly in regards to the lost tooth structure. So at Cornerstone Dental Center, how does our technology help to ensure that the process of receiving a filling is done efficiently, as comfortably as possible, and that the resulting filling is as long lasting as possible? So the things that I would look for in a modern office such as ours would be first, are their bonding protocols up to date? So the steps that they're taking to remove the cavity and ultimately to get a good filling place. The second I would expect would be that the materials they're using, both the bonding materials and the composite materials, are up to date and are going to be the best materials that they can find. And then the final thing would be just the equipment they're using in order to place that filling, making sure that filling lasts as long as possible for you. What is a point of confusion or a misconception that I've encountered in regard to dental fillings or cavities? Yeah, so I've spoken with some patients through the years about I've developed some sensitivity. I think that maybe I have a cavity, but I'm just going to wait and see. Maybe I'll wait for that to go away, or I'll change my diet, I'll reduce sugar. One of the things that I would caution is that once a cavity has started and moved through the enamel on a tooth, that process will usually continue until it reaches the nerve. And so just because a patient might be going through a period of time where they feel more or less sensitivity with that tooth doesn't mean that the filling the cavity has healed or gone away. And so sensitivity doesn't always indicate that there's a cavity, but if a cavity truly has started there, my recommendation would be to have that treated. If someone hasn't been to the dentist in a while and they expect that maybe they do have a cavity, they're experiencing some sensitivity in an area, what would be your next steps? I would say that the first thing to do would be to give our office a call. Let us know that you have a concern and a potential issue. What we would like to do is to take a look at the tooth or the area in your mouth, take an x-ray for you, and really get a good evaluation. And then we can determine what your next steps are.